Hello, Ted. We're just getting set up for live today. Thanks for tuning in. Hey, folks. How's it going? Thanks for tuning in. We're going live today talking about preventing STIs and LGBTQ plus youth. We'll be joined shortly by Sir Dave. As soon as he logs on. Thanks for joining us. Hello, hello. Hi, thanks for logging in. Thanks for tuning in to Instagram Live. I'm Ben Brooks with Whitman-Walker Health, and we're going to be talking about preventing STIs. Hi, thanks for logging out. Thanks for... Hi, Jewel. Hey, Audrey, thanks for tuning in. We're going to get started in a second talking about how to prevent STIs among LGBTQI youth. Q plus youth, excuse me. We're just going to give a few more minutes for folks to get logged on. Hi, Jewel. Waving at Jewel. Hey, folks. Thanks for tuning in. Hope y'all are doing well. It's a beautiful Sunday, a Monday morning, Monday afternoon out the window. Hope we're doing good. Hi. Who am I looking at? B-Pulse 97? Is that Brendan Pulsifer? That probably is. Hi, Brendan. Thanks for all your help last week. Nice. I'm just waiting on Dave. Sitting at the dock of the bay. Y'all don't want me to sing, I know. Hello. Ibuku, nice to see you. Hopefully we'll get to meet you in person soon. Hi everyone, it's Ben Brooks. We're just waiting on Sir Dave. Get started in our conversation about preventing STIs among LGBTQ plus youth. So glad you could tune in. Thanks. Glad y'all are here. I figured out this fun thing where my phone will allow me to copy the text for the pinned tweet on my computer and then paste it on my phone so that I don't have to type it out, which made it a lot easier, which was a nice surprise for me. So things are looking up on this Monday afternoon. Glad everybody's here. Hi, Tim. Welcome. We're just getting started here. We're going to have a great conversation about barriers and facilitators of access to treatments and preventions for LGBTQ plus youth. It's going to be a really good conversation. I'm excited for it today. Just waiting on our influencer. All right. Nice. Good to see my audio is coming through. Y'all don't want me to sing. I will pass the time though. Thanks. It's a beautiful yellow Whitman-Walker shirt that I found that they had in the storage closet. And I just started and I wanted to get as many shirts as I could It's a good color, right? Thanks for tuning in. Yes. I wonder if they still have them. Thanks, Jewel. I asked Jewel about them. I think we were just reorganizing the closet, actually, and I just asked for it when I found it. That's what you get. It's awkward, I could have this conversation by myself, but it's more fun if there's a dialogue between people. And we'll get more people viewing the video if we have a person of influence on it. All right. We're going to have a good time. I believe it. Oh my gosh, tell us about your weekend. Y'all, well, what did I do for my weekend? Mostly I ate, which was great. We had a good time. Hello, hello. Do we have a third person here now? Nice. Okay, just us chickens. Hi, Whitman-Walker folks. My faves. I recently, actually more interestingly, I'll say, I found out there's a rally next weekend, a March for Peace. I was like in my, getting my house in order kind of mode, and we found out we weren't doing much, but I thought, I would really love to go on a march. It feels like there's a lot of things to get marching in the streets about. So there's a rally this Saturday being sponsored by the National Black Justice Coalition and a variety of other organizations. It's a March for Peace, and they have 10 sort of specific policy priorities, but it's the 58th anniversary of the March on Washington. So it's a march sort of celebrating the legacy of John Lewis and the other leaders in that march. I am excited. I think I might go to be good. The other thing, I ate for the very first time at Wonderland Ballroom. They have a brunch. Hi, Sir Dave. Welcome. You've thankfully interrupted my extremely boring monologue. I'm going to view your request and go live. Hello, hello.
Hey, Ben. I am so sorry. How are you? I hope you're getting a good start to this Monday.
Hey, Dave. I'm doing pretty good. Just catching up on all the emails that came in over the weekend. You know how that works.
I know. You were probably sitting here like, where is Dave at right now? Sorry, there's a little bit of a mix-up on my end, but I am here, and I'm happy to see people are here with us.
Yes, you have attracted the crowds, Dave. You're quite the media influencer.
Right. So I do want to say hello and welcome back to Whitman-Walker's Instagram Live, our social media programming. So during the last few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics around HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health. Our community health team is always here to help educate and support you, and I want to thank you all for joining us. So today we're here with Ben. Ben's been holding it down while I was running a little bit late. But we're going to discuss LGBTQ plus youth and STIs, barriers and facilitators of access. So hi, Ben. Sorry I was late today. Nice to have you back. You are looking good.
Thank you so much, Dave. So are you. I'm glad to be back. How are things? How was the weekend? You doing good today?
I've had a busy weekend, so I had a lot of stuff going on, which is why the Monday is starting off a little bit rocky. But other than that, things are good. I'm vaccinated. Encouraging everybody else to continue to get vaccinated. And yeah, what about you?
Same over here. Busy weekend. Got to have some time with some friends. Got to spend some time cleaning my house. All the good things. Did my laundry. Uh,
Mhm.
just glad to be vaccinated. Glad to see the FDA has offered full approval of the Pfizer vaccine. So hopefully
Hmm.
we'll get the rest of those rolling out and we can get more people
Facts.
vaccinated.
Yeah, so today, we are going to be talking about preventing sexually transmitted diseases among our LGBTQ plus youth, right? That's the topic.
Yes, so we are talking about preventing STIs. I realized that the title just said access to STIs, which might have been a little confusing. Maybe more people will log on if they think we're going to help them get access to sex. But I wonder if that'll increase our viewership. Probably, probably. You never know. People want to know, you know? Yeah, but we're talking about preventing sexually transmitted infections, STIs. And because I'm a lawyer, we're going to talk about doing it like what the government can do to help
Okay.
prevent STIs. We're going to mention that HIV prevention tools a lot. So a few sort of terms and definitions to know so we can follow the conversation moving forward. I'm just going to go through them here. If you're living with HIV, then treatment as prevention means keeping up with your HIV meds and taking them as directed from your medical
Hmm.
provider, right? Doing this can help a person
Hmm.
achieve what we call viral suppression. This means that
Hmm.
the amount of HIV virus is so low in your system that we can't even detect it on the test. So that's considered undetectable. And that means that a person with undetectable viral load means that they cannot transmit the virus to other individuals through sex. This is really good news. So we call that undetectable equals untransmittable, or U equals U on social
Yeah.
media. And of course, newly diagnosed people or those who are starting HIV treatment for the first time can call Whitman-Walker to get started at 202-797-4437.
Hmm.
So the next one we're going to run through real fast is if you're HIV negative, we have this thing called PrEP, which is pre-exposure prophylaxis, which is a daily pill that is 99% effective at preventing HIV that is transmitted through sex, right? This is like birth control for HIV. You take it once a day and you don't get HIV. But
Yeah.
of course, instead of preventing pregnancy, it prevents HIV. Taking PrEP requires that you see your doctor about once every 3 months to check in with lab work and to fill your prescription. Whitman-Walker's PrEP clinic is designed to make it easy for people to get on PrEP and stay on PrEP. If you decide that PrEP is right for you can
Hmm.
contact Whitman-Walker to get on it by calling 202-939-7690 or by emailing prepclinic@whitmanwalker.org. That's PREPCLINIC@whitmanwalker.org. Okay, and then the last one, if you're HIV negative and you think you've been exposed to HIV and you aren't taking PrEP, you can take PEP, which is what we call post-exposure prophylaxis, which is a 28-day course of medication that can prevent HIV after you're exposed to HIV. Now, PEP has to be taken within 72 hours or 3 days of exposure to be effective. It's kind of like taking Plan B. Again, it's like pregnancy metaphor here. So PEP is considered an emergency medication. So if you can access it from an ER and you can access it at Whitman Walker as well by calling off our line at 202-797-4439. Okay, so those are the big medical details out of the way. We got everybody on level playing field here.
So thanks for the definitions, Ben. I do appreciate it. And for those of you who are not aware, I've talked about it previously on my lives, but I'm also on PrEP. I've been on it for a very long time. I haven't had any side effects. So I definitely encourage you all, if that is, a method you want to try, have that conversation with your doctors. It will definitely be a good thing to maybe consider. Especially if you're sexually active and you're out in these streets, as my friends would say.
That's
So,
good.
what does the government have to do with these approaches? Aren't HIV prevention strategies like wearing condoms and taking PrEP and achieving undetectable status, isn't that all about the individual deciding to take these steps?
Yeah, I think that's a big part of it, right? And it's true that like as individuals, we have a lot of control over our sexual health. And the things that you mentioned, right? The PEP, the U equals U, the PrEP and condoms. Those
Hmm.
are what we call like biomedical prevention strategies because they have to do with your body, right? So you as a person having control is very important.
Hmm.
But because I work in the policy department and we think a lot about what the government can do to make it a lot easier for young people in particular to take control of their own bodies.
Hmm.
And there are a lot of things that the government can do to make it easier for folks to get access to these things. In fact, we can't talk about all of them today.
Right.
Yeah, but
Wait a minute.
we're going to talk about the government's role, I guess.
Yeah.
Bigger picture. Go ahead.
Yeah. Well, I'm glad, that we get to, talk about, these methods and, opportunities to talk about condoms and PrEP and U equals U. So today, we are talking about young people in particular. And to be clear, most of the time when we say young people or minors, we mean someone under the age of 18. So when I say young people, that means someone under the age of 18. Now, Ben, right away, one of the barriers that I know that is pretty common is that people would rather not talk to young people about having sex.
Yeah. This is kind of the first thing we have to talk about is we don't want to talk about sex. And because sex is still stigmatized, right? And to me, at least, this form of stigma, not wanting to talk about sex, is dangerous because young people are having sex. The research shows, based on data from the youth risk behavioral system, that's like the test that they give you in school once a year, and you kind of fill in the
Yeah.
bubble about whether you smoke or drink and all of that stuff. So that data says about 1/3 or 34% of kids in schools have sex before 16. So we need to be talking about sex with kids.
Yeah. So, I mean, I think I agree. And I think it's weird that we always say that, talking about sex or sex isn't family friendly, which is hilarious, obviously, because most people, I mean, for most people, sex literally starts families, right? So in one sense, there's nothing more family friendly than sex. We know that people's comfort level about sex is really tied to their culture and their own cultural norms. But a lot of that has changed throughout history, and so I think we need to revisit how we think about and how we view sex.
Yeah, and especially in our culture with the rise of the internet and a lot of conversations going on, even in the past week, right? With like a good example is OnlyFans decided to take down the
Yes.
work of sex workers from their site. We kind of are having this conversation all of the time. We're constantly
Mhm.
negotiating and thinking about these boundaries. And I think it's kind of fun to be a member of the LGBTQ plus community is
Mhm.
really to be central to these conversations. I mean, gay sex was criminalized up until the 90s, right? And even really in as early as 2003, right? And then only in 2015 were gay marriages legalized. And so you weren't having any kind of sex inside of marriage or like socially acceptable sex among gay people for a really long time. And so as we negotiate these boundaries around who can talk about sex and who's allowed to even have sex, we need to be, I think, thinking about kids because kids are a part of our population of need. I just want to note, I think that right now in our culture in particular, part of the discomfort is in this conversation is related to the fact that young people are vulnerable to sexual violence and exploitation, right? But I say this, we can't let that fear stop us from having this conversation, and we can't let it stop us from educating kids about sexual health. It would be backwards in our fear of talking about sex with young people that we didn't give them the opportunity to like exercise their bodily autonomy and take control over their lives. So this is the first thing the government can do, right? Is to make sure that young people have all the tools to prevent STIs, that they can educate in schools about STI prevention tools in scientifically accurate and destigmatizing ways, right? And it's really important, I think, for LGBTQ plus youth that the sex education include their stories and be inclusive of our needs.
Absolutely. I'm super happy to hear you say that actually, because I think, it's extremely important to have inclusive conversations about sex as education. I can imagine, if all that you are hearing about in your sex education classes is, preventing pregnancy, and that gay and lesbian students might feel that this information doesn't really include them or apply to them. And so they might just zone out or dismiss it entirely. And I know from being a gay, queer guy and growing up, I never had any or received any advice about in school or in sex ed about, how to have safe sex. And so I think these kids need good information from trusted sources, like their teachers. So it is important to include relevant information on gay sex, and how to protect, themselves from STIs when they are having sex with someone of the same gender. I think, it's so much information that can be provided that's being missed.
Yeah, yeah.
So
Go ahead,
how
go ahead.
important is it for us to prevent STIs, among young queer people? Why do you think it's a driver? And can you tell us a little bit about the numbers?
Yes, and so we're going to talk a little bit about the epidemiology, right? This is where I get to use my public health background. So the CDC says that about half of all of the STIs every year are in young people. Now, this is where we have to get particular, because they say young people are ages 15 to 24, right? So they've got kind of a wider range than folks, but those are the numbers we have, so we're going to work with that for right now. So it's 25% of the population of people having sex, which is that 15 to 24, are having 50% of the STIs. And so if we can reduce the STIs in that population, we have an outsized effect on really keeping people safe, right? And for HIV in particular, a quarter of new HIV infections each year are among youth ages 13 to 24, right? And so these are high rates compared to the rest of the population, and the second most fastest growing sort of rate of transmission of HIV. So there's a lot we can do in keeping young people safe by teaching them about how to prevent STIs, including HIV. I also want to note, Dave, this is an issue of racial justice because according to the CDC, again, young Black and Latino men and boys bear a disproportionate burden of HIV infection and are more likely to be unaware that they're living with HIV. And so it's really important from a racial justice standpoint and from just a regular old public health standpoint that we support access to STI treatment, testing, and prevention for LGBTQ plus youth.
Wow. First of all, thanks for sharing the statistic about, the proportion of STIs that are actually new cases are 50% is in youth. I did not know that. That's actually like mind blowing, and it like totally makes sense now why we will want to target youth with sex education and learning how to protect themselves from STIs. So thank you for that. So, what else? Stigma around sex and gay sex in particular can make it hard for young people to talk about, sex to their parents or their guardians. Are there other places young people might go for information about sex if they have questions?
Yeah, I know when I was growing up, I didn't get sex education in school, and I didn't get it from my parents. And
Oh,
so,
wow. Really? You
right.
didn't get it at all?
No, well, I was homeschooled, so we can cover that
Okay.
in a different live. But the place that I turned was the internet, and that's not a good place to get. It's not a good place to get information about sex. It can be, but it's hard to find. And kids in particular aren't necessarily good at knowing good information from bad information, right? So we want to find trusted sources of information. And the best and maybe most available is a child's doctor, right? So it's safe usually to talk to a trusted family doctor about your sexual health needs, and especially for children, they may not feel like they can talk to their parents, and they may not get it from their teachers, and so going to a doctor can really help. So the thing again that the government can do, right, is provide free health care for kids and families who have kids so that kids can begin to develop a relationship of trust with a pediatrician. One of the things that we talk about in in policy is the process that kids learn how to engage with a doctor. This is called health literacy, right? So if you have a trusted doctor from a really young age, children can grow in their confidence and their familiarity with that doctor. And some experts even recommend like children can play a leadership role in their own health by including asking their own questions of the doctor, right? And having the doctor ask the kids directly for permission to do the medical exams, and these kinds of things really like help kids develop the skills and the ways to set boundaries and take control of their bodies by understanding sort of when you can give positive permission and when you can withhold permission for somebody to touch your body, which is a very important, again, like sexual health skill.
Yeah, I think that is extremely important. And I will say, although I was not like out to my mom, growing up, I always felt that she gave me autonomy over my body, those sexual decisions, and she always made sure I had an open platform to have those type of conversations. Even though I was still too afraid to come out to her until like I was like in college. But I do remember us like going to the doctor and things like that, and asking me if she wanted, if I want her in the room, or if she wanted, and when I look back, I thought it was kind of weird. I was like, of course I want you in the room. Like, I don't want to be here with this person. But, now that I think about it, she was really just trying to give me the space to have those conversations, or any conversation that might be uncomfortable in front of her with my doctor. So I agree. Kids, can talk to their doctors about sex, but can they get treatment for STIs? Can they keep it private from their parents? Like, my mom gave me that space, but, was the doctor just going to tell her when she came back in the room? This seems like it could be very controversial.
Yes, very good. Asking the real questions, right? Because it is controversial, and that means, at least for now, like it depends on the state where you live. If you can, as a minor, as a person under the age of 18, ask your doctor for treatment and testing for STIs and prevention, right? So we're going to get into the details a little bit here. So many states do allow minors to consent to treatment and prevention of STIs without parental consent. But not all of them define HIV as one of those STIs, right? So Virginia and Maryland, which we have a lot of patients in Virginia and Maryland, so they permit minors to consent to HIV testing and treatment, while DC and West Virginia permit minors to consent to STI prevention, diagnosis, and treatment. So this is different, right? Now, sometimes there's vagueness in the law, right? So we got to figure out what's going on. For example, in DC, the regulations include HIV on a list of STIs, but the law says minors can consent to STI prevention and treatment. So we say, okay, so HIV is an STI and minors can consent to STI prevention. So we kind of bridge that vagueness or that gap there, which is kind of fun. So in DC, we concluded, the medical providers talking to the regulators, everybody talking to each other, making sure that we're on the same page, that providers can give minors PrEP without their parents' consent, which is really great. Maryland goes even farther. Maryland says, sort of in the law, written down, quote, that minors can consent to, quote, treatment for the prevention of HIV. So it's really clear, and I like this approach where you just make it crystal clear and you don't have to sort of draw the bridges there. So
yeah. Okay. Well, it does sound like, that the governments can do some things to improve access to STI prevention. And one of those things might be to make it clear that minors can get access to these tools without having their parents' permission. I didn't know that, and I'm sure some parents probably don't know that, and some students or youth, I should say, probably don't know that either.
Yeah. We're trying to teach them, right? This is why we're out here. Because minors need to know that they can ask their doctor for these tools. And some schools, you can go to a school nurse and get condoms. Some schools you can't, right? So the government really can, through policy, just make these easy biomedical prevention tools much easier to access for students, for kids, for minors, however we want to say it. I also want to note here, it's also not just getting access without having to ask your parents, but the privacy of making sure like that your parents don't find out through other means, especially they're in the age of insurance, right? You got to have insurance usually to get medical care. And so the insurance bill gets sent back to your house. And so this can be, if your parents are reading that bill closely, they can see maybe that you have access to an STI treatment or an STI prevention. And so they might cause them to raise questions, especially, right, if they have an LGBTQ youth, right,
Yes.
where you don't want to be outed by accessing these medical care because it could be dangerous to you. So what we advocate for, and actually what we really want to see nationwide, is that insurance companies make it a lot easier for patients to say, actually, this service needs to be private because it can be dangerous to me if it's disclosed, so don't put it on my bill, right? And different programs let you maybe pay out of pocket for that so it doesn't show up in your insurance. But HIPAA, the Health Insurance Portability and Accountability Act, requires that medical insurers give patients the opportunity to, if they need extra privacy for these concerns, in particular, out of danger that they might be harmed, which outing you is a real harm, that you can ask for extra privacy protections, and they have to take that stuff off of your bill. So it's hard. It can be hard, again, right? The right exists, but how do you get it? We want to make it easier. So Maryland, I'm going to call out Maryland again because they made it really easy. They have a simple one-page form where you fill it out and your insurer doesn't put those things on your bill. So it's one of those places where DC and Virginia and West Virginia could follow suit and make it a lot easier for folks. Or the federal government could put in sort of a nationwide system. So there are all these kind of options, but that's another one that the federal government or the government writ large can do to make it easier to access, is protecting kids' privacy.
Yeah, I love that. And I do think it's important. I think it's important because I am in my 30s and I still have mail that ends up at my mom's house. And what she does, she opens it. And I'm like, and I tell her all the time, like, stop opening. So I could only imagine, youth who living with their parents and getting things that are sent to the home, how that might be an issue. So I'm glad that we're being able to share this information to our youth, letting them know, like, if there are things or treatments that you're getting around your sexual health, that, you can ask for extra, privacy. Now, you brought up insurance. What if a person does not have insurance? How can someone pay for STI treatment and prevention services, especially someone who is young and might not have a job or any way of getting money to cover those expenses?
Yeah, that's a real good question because money makes the world go around, right? Like in the United States, the federal government does a lot actually to make it a lot easier to access STI prevention tools. Since 1990, the Ryan White HIV Prevention Acts make sure that every person living with HIV can access a HIV medication regardless of their ability to pay. So that's our U equals U. That's one thing. The government provides a big safety net there. And then for PrEP, since January of this year, actually every insurance company has been required to cover PrEP without cost sharing. So that means you don't have to pay for the doctor's visit or the labs that we talked about earlier. So this is really good news. And I mentioned those two things because in DC, Maryland, and Virginia, all those states have expanded Medicaid. And so everybody who wants health insurance should be able to get health insurance. And of course, if you don't have health insurance, even as a minor, you should be able to contact Whitman-Walker's insurance navigators, and they should help you get on any kind of health insurance that is accessible to you. Even people who are immigrants and undocumented people have access to health insurance in Washington, D.C. So it's a good news.
Yeah.
Sorry, gotta plug it.
Especially the news about PrEP, because I remember, when I first got on it and paying all the co-pays. And I mean, don't get me wrong, I was lucky to be able to afford it, but still, it's an added expense. And I don't think you should have to pay for protecting yourself. Like, let's just say that. Yeah.
Absolutely. And paying to protect yourself just makes it harder, right? It makes it's again, if you really, because we live in America, having money is a big deal, and not having money keeps you out of the system. In addition, for like just the labs and the medications, the government can help also by paying for things like transportation, right? And to and from the doctor. And so some of the cities had some programs where they would pay for the train ride or the lift or the
Yeah.
bus that kind of got you there. These tools can overcome a lot of barriers that keep people from accessing all of the HIV prevention tools. One of the other sort of, well, these go in a big basket that I call the social determinants of health, right? And
Hmm.
these are things like housing. These are things like access to education that we talked about. These are things like clean air, drinkable water, and nutritious food. Like, these are kind of these human rights areas of everybody needs these social determinants to stay safe and stay healthy. Without a safe place to sleep and a secure place to keep your medicine, and it's hard to prioritize your sexual health. And so in the policy department, like, we see that the government making these things easier, like providing transportation, like providing housing vouchers, these are all health sort of policies that we want to talk about and really promote, which is really kind of fun.
Yeah. So, wow. We covered a lot of stuff today. Is there anything else?
I think that's probably enough for one day. Just to kind of put a cute little capstone on it. Let's see. We've got three things. Let's call it. So, destigmatizing education, protecting privacy, and paying. Right. Those are the big things that the government can do to help LGBTQ youth in particular sort of
Exactly.
stay healthy.
Yeah, so thank you for coming out today and joining us. We're here with Ben. Thanks for joining, Ben. It was great to have you. Anything else you want to leave with our group?
I
Or
don't think so. Just, if you have any other questions, put them in the chat. I'm trying to check the chat to see if we have any questions. I'm not seeing any
I
right
didn't
now.
see.
Oh, I've got one. Will this be available for viewing later? Yes, it will. We keep all of our Instagram lives that we manage to save properly. That's a caveat there, because sometimes we mess up. They're in the Instagram archive, and I think a bunch of them are posted to
Yeah.
YouTube. So if you like this video, they'll be available later.
Yeah, so thank you all for tuning in. I do want to point out that I want you all to please continue to follow CDC guidelines for mask wearing, quarantine, and social distancing, and the like. It is still very, very, very important that you get the vaccine. Discuss COVID precautionary measures with those around you. That includes your family and your friends. Be mindful of wearing your mask and keep your distance, especially when you're out in public, especially when you do not know whether or not someone else has been vaccinated. And big COVID news today, as we mentioned earlier, the Pfizer vaccine has received full FDA approval for use in people ages 16 and older. So I am hoping that encourages more folks to get the vaccine now that we know the Pfizer vaccine has received full FDA approval. And one of my favorite parts is telling you all to continue to follow us on Facebook, Instagram, Twitter, at Whitman-Walker, and continue to check out our website, www.whitmanwalker.org. We are constantly posting up-to-date information, whether that be about HIV, STI practices, COVID-19 services. Just continue to follow us. And if you need COVID testing or vaccine or any general Whitman-Walker services, you can call us at 202-797-4439. Also follow some of our other programs. We have a large Whitman-Walker family. So you can also follow us at Real Talk DC _ and at No Filter DC _ And we have a really cool spot located on 14th Street. It's called The Corner. You can follow us at The Corner DC. We do a bunch of cool stuff there. Check it out. And if you're looking for ways to support Whitman-Walker, you can register for our walk, run, and donate at our 35th anniversary of the Walk to End HIV, which was formerly known as the AIDS Walk Washington. So you can also register for that walk, walktoendhiv.org. I will see you all next time. Ben, thanks for being here.
It's absolutely my pleasure, Dave. Thanks for coming on. Have a good rest of your day.
Thank you. And I'll try to be on time for everything else today. Bye.
Talk to you later. Bye. All right. Let's see how to end this. Thanks, y'all, for zooming in. Bye-bye.